say hi and see everybody, you're more than welcome. We wanted to give everybody the opportunity. If you wanted it to be off just, you know, for privacy or whatever, that's completely fine. But if you want to turn it on and be more interactive with us, you absolutely can. So thank you for joining us today. One quick housekeeping thing so that I don't forget, because I will. Brooks Hill is here as well. Say hi, Brooks.
Hi, guys.
We are going to give you guys a little $25 credit for your account for when you come in to see us next time to say thank you for attending our webinar today. So make sure you send your email to Brooks so that we can go ahead and make sure that you get that credit on your account, just as a little thank you for hanging out with us today. And I'll repeat that again a couple times, Brooks, as people kind of join in so that we can put that on there. But remember just to send it to Brooks. If you have a question throughout any of this, please feel free to ask. Just send it to myself or Amy. Say hi, Amy.
Hi, guys.
And we'll be sure to answer your questions. If you accidentally send it to Brooks, that's fine. She'll let us know. If you send it to everybody, that's fine too, because probably people have a lot of the same similar questions. So we'll just go ahead and get started. I am sorry, my daughter just walked in, so I want to make sure she didn't need anything. Yay, we're
Get really personal here.
Yeah. So thank you guys all for coming in. I'm Jenny. I'm a physician assistant at Azura. If you haven't been in or you haven't met me in the office. We also have Jessie and Amanda, who are also PAs, and we also have Amy that's here with us today. She's going to introduce herself here in just a second. But I'm a PA, and we've been open 4 years as of yesterday at Azura. So we're at our birthday, we're having our anniversary. So thank you guys who've been with us and who have joined us. But I've been working in aesthetics for about 11 years. I've been a PA since 2002, working just in aesthetics for about the last 11 years. I also teach kind of all over as I work with a company. I do private training, but I also work with med aesthetics just to do some teaching for them. I don't do quite as much as I used to do just because owning the business and, you know, still seeing patients is tough, but I still kind of travel all over and do some teaching. So I'm actually going to show you a couple slides that they've given me permission to show you that's actually from med aesthetics, from when I actually teach. So that's enough about me. Amy, you want to say hi?
Hey, guys.
Tell us about you.
Yeah, well, you know, Jenny and I just jive with Jenny, and she's got an amazing practice in Cary, and she's allowed me to work with her for the last year. Super excited about that. I've been a nurse injector for about 15 years. I am a certified plastic surgery nurse as well as a certified aesthetic nurse, which are board certifications that you have to take as a specialty. So when people talk about master or advanced and different things, you know, that certifications come with a little more education and certification testing. So anyway, that being said, I've worked in plastic surgery for the last 8 years in Raleigh. I'm originally from Michigan and have been with Azura, like I said, for the last year, and just learned all kinds of new tricks and things with Jenny and the team, and love them. So glad to be here with you guys.
Yeah, Amy works with us mostly on the weekends. So we're very blessed to have her come be with us and stick needles in us and stick needles in her and have fun going back and forth. It's always fun when we work with other individuals because we learn from everybody as we're moving along, and we pick up tips and tricks from everyone. So, all right. Like I said, if you're just joining us, make sure you send your email to Brooks Hill, who is on this as well as a moderator, and she will make sure that you get the email with the $25 as a thank you for joining us here today and learning a little bit about botulinum toxin. So I'm going to talk, we're going to show you some before and afters. We're going to talk about specifics and how many units and those kind of things. But I wanted to give you just a little bit of background first. You know, Botox, one of the number one questions that Amy and I and Jessie and Amanda, you know, we always get is what is Botox and is it safe? And is this a newer thing? And how am I going to look? There's all kinds of questions that wrap around when we do our consultation. So we want to take the opportunity today to kind of go through some of that with you. There's a physician that really kind of started as the pioneer. His name was Alan B. Scott. And he was trying to find a treatment for strabismus, which is an ocular condition where there's some twitching and movement of the eye. The ocular muscles don't quite tend to work correctly. They're over contracted in one direction or weak in one way. So he was doing some studies knowing that botulism toxin can cause some neuro effects and inhibit some muscles from being able to be used. So started doing some very limited studies. He actually was working with animals to try to see if he could correct the extraocular muscle movement in, I believe it was monkeys or apes or something like that. And that was back in the 70s. And so through that process, found that he could actually correct some of those muscles strategically in certain areas. And it was first trialed on humans in 1978. And this is before Botox was used for cosmetics or anything back in 1978. So it's been studied for a very long time. So very safe, very efficacious. And then it was actually published in 1980. There was a landmark publishing done on this. And so it really in the 80s started to take off on using botulinum toxin for use with muscle issues. And then there were two doctors from Canada, Carruthers and Carruthers, husband and wife team, dermatology and oculo specialists that teamed up with Scott to really kind of make progress on figuring out what we could do with these muscles and how we could really inhibit making them, work correctly and making some overactive muscles or underactive muscles try to work better for us. And that came along, through the 80s. And then actually in 1986, before we had Botox, there was, I believe, I don't know, Amy, if you remember, I think it was Oculinum, and was actually the name that was given to the medication, and it was used for strabismus. And then it actually kind of lost a little steam because they didn't meet all the requirements. And then it finally got FDA approved in I believe it was 89, somewhere in there, to start being used. The nice thing is that for us, for cosmetic purposes, it also noticed that a lot of things in medicine we find are, found by chance, right? So these patients who were getting the medication for ocular issues, they also noticed that like the glabella lines were not as prominent, and cosmetically things were starting to look better. So more testing was done in this genre. And then Botox was the first type A neurotoxin that got an actual approval in 2002. And then we have, since then we've had three other that are FDA approved in the United States to use. We have Botox, Dysport, Jeuveau, and Xeomin. Xeomin came out before Jeuveau. I think Xeomin was 2011 and Dysport was 2009. Then Jeuveau just got FDA approval in 2019. And a lot of people are like, which one should I use? They're all neurotoxins. They all work well. They're all good for cosmetic purposes. Which one should we use? There's very slight differentiations between the products, but they all basically work the same. And Amy will probably agree. It really comes down to more of like the injector, how it's being used, how many units, where it's placed. There are some slight differences in the molecular size of some of the products and the proteins. I'm talking about kilodaltons, and Botox is, 900, and, Dysport is 500 and 900. So there is some molecular differences at the cellular level with these proteins, but it's very slight, but they all have the same mechanism of action. They all work the same. Fair enough, Amy, I think.
My favorite thing about Jennie is she's super science-based. Sometimes we all get a little bit lost in it, including me. So we all want to let you know that there is some substance to the backing of this medication, which is why we always make sure that we don't want to mislead anyone that,
Right.
Botox is obviously something that is an amazing cosmetic treatment, but it's also a medicine. So we have to make sure that the person that you're getting your treatment from has that knowledge and knows how to, utilize that medicine, because it really is still medicine. So
Right.
that Jennie is a PA that can provide that. Me as a nurse, I can't even do Botox without a guide of a mid-level or a physician to tell me that I can inject it. So it's really important who you pick as your injector and know that they know that. So just that being said, Mainly, I pick a neuromodulator, Jeuveau or Xeomin or Botox or Dysport based on skin type, sometimes based on gender or that strength of that muscle. So the science is behind it, absolutely. And then it kind of comes into play where, when you go in and ask for a certain brand, because it's like Kleenex in tissue. We're all familiar with Kleenex, or I'm sorry, tissue, but obviously we'll call everything Kleenex because it's so branded. So when patients come in and say they want Xeomin, great. Can you tell me why? Is it based on your experience, or is it just, because you've been branded that? And it's like going into your physician and asking for an antibiotic. I want to treat you with what I think, in my experience, would be best for you, and that's how I pick a filler or a neuromodulator.
Yeah. Yeah. And, kind of just going through all of that information, just because it does give a little bit of history, and it is, showing that it's been studied for a long time and it's safe, and it's kind of neat. And I am kind of nerdy like that, like knowing all of those things.
Amen.
But yeah, I love it.
Favorite thing about her. Yeah.
Yeah. And it's just, but it really comes down to the difference in the products that I always tell people all the time, if you start with Botox, you love Botox, get Botox. It's great. If you want to try something else, you want to try Dysport, try Dysport. There's Xeomin, and Jeuveau is the new one, like I said. A lot of times I'll just say, which one has a special right now? Which one has Botox has brilliant distinctions, and you can get points with that. And Dysport has Aspire, and you can get points with Aspire. And so sometimes the companies, competition is good, guys. We love competition because it helps price control these products. And so a lot of times they'll come out with a coupon. It's $50 off this, or Botox, Amy, you probably agree, like they did their most brilliant promotion last year where, you got $50 off your first treatment, $50 off your second treatment, and then your third treatment, you can get money off a filler. And then the fourth treatment was you got like your average units up to 15 units free, from Allergan. So that was like the most brilliant promotion to try to keep people brand loyal onto that product. But does that necessarily mean it's a better product than, Dysport or Jeuveau or Xeomin? Not necessarily. Everybody does respond a little bit differently to different products. So, if you want to try one and then try one the next time, you absolutely can. There are sometimes, this kind of list where we get really real. Dysport tends to last a little bit longer for me. That's for me, but I've had other patients say, don't give me that garbage, give me something else. Why is that? It's just everybody's body is a little bit different. So I tell people that, just because one thing works better for one person doesn't mean, it's going to be the same for you. It really comes down to, I think, a lot of times the injector, and knowing, really understanding what someone wants out of their treatment, and then delivering the appropriate amount of units that you need for that area. If we recommend that you need 10 units of Botox or Jeuveau or Xeomin, or 50 or 30 units for Dysport, then that's what you need. Sometimes, and I'll say sometimes I'm wrong, but for the most part, if we're trying to get a nice result, Amy and I and other injectors around, we've worked with these products for a long time. We really know, typically what someone is going to need. It is always better, in my opinion, to kind of go on the lighter end. If somebody's nervous or they're not sure how they're going to respond, or let's say they have a heavy brow, we go a little bit lighter. But that doesn't mean that, if you come back and need more units, that doesn't mean that it was a bad treatment or it wasn't the right product for you. It just means you need a little more units. And so we have to, go in and maybe touch it up or put a little bit more in after about 2 weeks, so we can get the look that we actually want to achieve. Some patients, so Botox is indicated for glabella, forehead, and crow's feet. And, they say, everybody, it was FDA approved at, I think, 20 units, Amy, for the glabella is the standard. Mm-hmm. And, some people need 15 to 16, some people need 25 or 30 in their glabella, but there is a standard dose. And so that's where your injector, knowing you and knowing the results that you want, really kind of comes in to figure out how many units you need for the look that you want to have. Mm-hmm. Just because somebody needs 20 units doesn't mean that you might not get a nice response with 15, or you may need 25 to 26.
You can layer any of those products too. Say I'll sometimes look at a patient and they come in for Dysport and they come back, and I have a preference for Dysport with people with blue eyes, and don't take that as science. That's just my experience in a pattern that I've seen has worked for me, but that does not mean that Botox is bad or, different things like that. I just have a preference for Dysport with people with blue eyes. So I, say a patient comes in for Dysport, I will inject them maybe as a touch up in the forehead for just a lighter touch with Botox, just because I have a little more control with Botox with a unit or two. So, if we layer a product of a different kind, sometimes there's been questions of why, and it's really just a matter of a light touch here and there that you can use, all 4 products if you wanted to together.
Mm-hmm. Yeah. One of the questions I sometimes get when people have done their homework and they've Googled and they've researched, they'll say, well, I read that, Botox has more spread. And, it doesn't, people are, I'm afraid because I don't want to use this product that's going to spread and it's going to cause my brows to droop or my, lids to drop or something. It has to do with the molecular size. Again, that's kind of where the nerdy part kind of comes in with me. It's not so much that it comes down to the injector. You have to know, if I have my hand here, if I inject Botox right here, I know how much it's going to spread. It's going to spread probably about 1 centimeter around that area. If I inject Dysport, maybe it's going to spread about 1.5 to 2 centimeters around that area. So I know that, and that's a good thing sometimes. Like what Amy was saying is sometimes, like with, red crow's feet or certain areas, we might want to get a little bit more, soft appearing, a little more spread in some areas than others, versus when you're talking about your light touch with Botox, maybe we don't want, we want it to stay exactly where we want it to be. And, that doesn't mean that we can't use it. Yeah.
It's so important. I think that's why the follow-ups, I do a 2-week follow-up on all new patients. I know you do as well. And I think the other girls as well. But for me, it's about, making sure that, your injector understands your anatomy. And the best way to understand that is consistency. That first injection is not a crapshoot of sorts, but with your particular muscles, we really are honing in on just experience. And it's really important to, go see your injector consistently and have them listen. And if they're listening, you guys will get it right together.
Yeah, absolutely. They all work. I love all the products, and it really does come down to your injector and making sure that you guys have that you're on the same page, that you're really communicating what you're looking for. It comes down to what kind of a look do you want, really working with your injector. The best injectors are the people that, really take the time, do before and after photos. Before and after photos are great because we can show you your results, but it's also, for me, it's something that if you have to come back and you need a touch up, it doesn't mean that we did a bad job or whatever. It's just, there's certain areas I want to be able to mark those muscles exactly where you were still pushing. That's maybe your right brow is a little stronger than your left brow. And so I want to make sure I take that picture so that I can make sure that I get it 100% right on that second treatment. I always kind of joke around and tell everybody when they get Botox or Dysport, I always say Botox just because it's the easy one to say. But of course, If I say Botox, it means all of them, any 4 of them. But when we inject, I always say you're going to really like your first treatment and you are going to love your second treatment because the muscles, when we first treat you, the muscles are like we're injecting something that causes this inhibition of these neurons to, it's selectively stopping acetylcholine, and we're, again, getting into that, kind of scientific, but we're telling these muscles don't move, and these muscles and these nerves, they want to communicate, they want to connect, that's what is normal. So when we're injecting and we're blocking this response, the muscles at first are like, what just happened? Like, what's going on? And they, over time, tried to get back together. These little sprouts on the nerves kind of start reaching each other again. And then all of a sudden you have movement back. It's one of the beautiful things about these cosmetic treatments is that they're not permanent. It would be nice if we never had to see a forehead line, but, they're not permanent. So if you did have an outcome that you weren't exactly 100% pleased with, we know that it's going to wear off. And so there's no long-term, permanent issues with any of these toxin treatments. But after you have kind of trained your muscles, if you're a hard furrower, I don't know anybody on this call, if you've ever, really when you're concentrating, if you're really listening to me right now, look at yourself in your video. And, if you're really furrowing, Lisa says guilty, she's a furrower. Furrow for me, Lisa. Yeah. So if you're listening and you're like really concentrating, you're probably furrowing, just trying to really understand what Amy and I are saying. And over time of doing that, you're making that habit. You're making yourself furrow. You're making yourself, those muscles are creating. And then over time, you go from, when you furrow, you have these lines that are dynamic lines. Those are in motion because you're making that motion, but then over time you start to see them at rest, and those are called static lines. We see those at rest. You don't even have to furrow anymore, and you can see those 11s or those furrow lines. So when we're using the toxin treatments, we're basically telling the muscle not to move, and we're putting it into training to not move. It's just like going to the gym. If you were to work out and you were like doing bench presses and all these, bicep curls, and you're training these muscles to get bigger over time, and they look nice and enlarged and you're strong, but then you just stop working out. Eventually your muscles kind of go back to being weak and smaller. So we're basically doing the opposite of your workout. You're doing the workout all the time on your face. And we're telling it to, take a chill, don't move around so much and make these lines. So I'm going to take a look just real quick. Amy, if you have anything to say, I'm going to look at these questions that are starting to come in to make sure that we don't miss anything on this one.
Yeah, it's always funny because when I came down here, from Michigan, it was interesting, and thank God I'm down here from Michigan, by the way, if you watch the news. But that furrow is not a word I use. I say scowl. So as soon as it's so different on what people try to do in a different word. So I say scowl, and people may frown down here. But if you try to furrow or scowl on demand, try it at home, because I'm telling you, it is not easy to do. You think like, yeah, I should be able to do this. And you're like, am I doing it? Am I doing it? And especially after you get Botox, you habituate out of that frown or scowl. And then you are seemingly more approachable. That's the beautiful thing about Botox, is that it's not that we're all about vanity and wanting to look better. It actually is proven that you feel better because you look better. And we find that aging can sometimes make you feel like you're disappearing. And I think that we will find with some of these cosmetic treatments that they actually make you feel more face forward out, doing whatever you're doing. And it makes you more approachable. I've had a patient come in and say, the janitor came up to me the other day after her first time Botox, and he said, you seem so much happier. It's not that she had changed her demeanor, it's just that she looked softer. So there's a lot to be said for that.
Yeah. Brooks, do you want to show that first slide? I'm going to just skip the one I had, but if you want to just show that first slide of areas that can be treated, Brooks is going to kind of share her screen. We want to just kind of give you an idea of the areas that we can take care of. So while she's pulling that up, one of the areas that we've already talked about is that furrow or the scowl in between the brows. This is the glabella, and there's a complex of muscles here that push together with the procerus and the corrugators, and they actually push together to make that muscle move and to give those 11s. And it also depresses, it pulls the brow down when you do that. I can't do it much because I'm pretty fresh. I got a little tox right before this whole
Lucky fucker.
I'm like, yay, for a little while.
I think Lisa had some too, didn't she? She looked amazing.
Yeah, Lisa's got a little bit of movement. She's had a treatment recently, so we'll
she looks good. Let's see all your faces. Come on, show me that scowl.
I know, right? I want to see them.
I'm gonna try to share my screen. This is only the second time I've done this, so fingers crossed. Here we go. Oh, wait.
And yeah, you can also treat your forehead. So Amy and I both have bangs, but when you raise your brows again, I'm pretty fresh. So I really don't have a whole lot of wrinkles going on up here, but this is the frontalis muscle. Brooks, if you can, yeah, I didn't want you to hold just because the frontalis muscle is the levator. It lifts your brows up. And so we tend to get the horizontal lines that kind of run across, and that's from that motion of the frontalis. We also, because the brow lifts up, when we treat the frontalis, Amy and I and other injectors and Jesse and Amanda in our office, we don't want to knock that function out completely. Brooks, if you can advance to the slide with the face with the areas, we don't want to necessarily knock your frontalis out completely, because you want to be able to, even though I have a block and no wrinkles, I can still move my brows. This is important. You need to be able to make some expression. If we knock out the frontalis muscles, actually this is a good before and after picture. He's in the middle picture here.
You want me to go back?
Yeah, that's fine. You can go back just to show real quick, and then,
I'll get a hang of this in a minute, guys. Bear with me.
You are doing great. You get an
Yeah,
A.
absolutely.
You know, these lines here in the middle of the glabella, I'm like pointing at them like you guys can see me pointing, but in the glabella between the brows and then the forehead lines up above, they run horizontal. It's kind of cut off in this picture. That's the frontalis. We can also get a brow lift. You can see on the right side, it's pointing to her brow. We can actually get that muscle to pull up. If we treat the glabella in the center, that helps. Like when I furrow, you can see my brows pull down a little bit. So when we treat this area, it actually helps to elevate the medial aspect of the brow, the inside aspect of the brow. And then that lateral, where that blue arrow is pointing on her eyebrow, we treat this lateral aspect, and it actually gives a little bit of a lateral, you know, a lift on this side to get a little bit of a brow lift out here. It's okay if we just do this area and lift up, but I'm not a fan of just doing a little bit here and getting this lift here unless somebody has a higher glabella area that they're not dropped, because then sometimes they'll get a little bit too high on the outsides and then it's not complementary to the middle. So do you agree with that, Amy? Do you try to?
Yeah, I think everybody comes in and they want to say that they want their forehead lifted, and so they think that Botox is going to go into the forehead. It will actually, Botox or any of the other neuromodulators will work the opposite way of what that muscle works. So these guys in between your brows depress down. Botox will lift them up. Although we like the lift that we get from a natural muscular movement, we don't want those lines. So we have to soften that down, and Botox will, quote unquote, depress that. But with the right artistic injection, you're just going to get a light touch. So we reduce the wrinkles without, you know, knocking out the movement. So just as a side anatomy note.
Yep. And then we also treat around the eyes, the crow's feet area. There's one little arrow that's going under her lash line, the mid pupillary area. It says jelly roll. This is something that, you know, we can put a couple little tiny drops of Botox right under the pupil area, and it just kind of helps to soften this area. It's not going to get rid of if you have a larger fat pad protrusion underneath the eye, where that fat is actually kind of shifted forward and separated. You know, the cheek separates and then the fat pad comes forward. It's not going to get rid of that completely, but we can try to keep the muscle from pulling up. I've got a little bit of a jelly roll myself. This hasn't been treated in a long time, but if I put a couple little units of Botox or any Dysport, anything, again, just saying the Kleenex of the four, it just helps to get it to kind of smooth out a little bit and not push up as much. We can,
Jenny, that the preventative in that, even when you have, you know, Jenny's young, obviously, and so if you would add a little bit of Botox in that little jelly roll now, it will help keep that muscle, you know, somewhat in skin tighter to keep things kind of compressed down, because as we age, that elasticity of the skin and the muscles start to shift and change underneath. But if we can keep it as tight as possible, that's where the preventative measures come in with the injections.
Yeah, absolutely. We try to prevent things before they become a problem, for sure.
Yeah.
We can do the bunny lines on the side of the nose. Mine haven't been treated in a while, but that's sometimes people, when they furrow, they instinctively, when I furrow, I don't necessarily bring my nose up, but when you furrow, a lot of people bring the sides of their nose up. And if we treat the glabella and get this nice and smooth, and you're still trying to furrow and, you know, you're not having motion there, but your nose is still pulling up, it looks kind of funny. So when we do your evaluation, we're looking for that. When you furrow, if you also draw your nose up, we want to make sure we treat those bunny lines. And even if you don't, if you start to see the wrinkles in the side of the nose, we go ahead and treat those. They're called bunny lines because it's like you look like a little bunny when your nose scrunches up. So you like that?
It's supposed to be cute, but it's not when you're 40.
Yeah, it's not so cute when it's on the nose. I don't treat it says nasal flare. I kind of just added this in. I don't do that very often. Some people, if they become hypertrophic a little bit, the muscle becomes a little larger because they're always flaring their nostrils. You know, that's an area, and some ethnicities are a little bit, you know, different with that, but that can be treated. The nasal tip underneath the nose here, if you have a, you know, downward turn nose, we can try to get the tip of the nose to kind of pull up a little bit. I do some of that. Gummy smiles, this one's, you know, pointed to the corner of the nose. That's actually this little area down here on the side of the nose. When you smile, a lot of times people smile and their lip kind of just rolls under, and you can see all the gum above the teeth. And so if we want to try to make that muscle relax a little bit, we can treat the gummy smiles to get, when the smile, the lip stays down a little flatter. We can put a little bit of Botox above the upper lip to get some of these wrinkles that when you pucker, you know, to try to get these muscles to suppress a little bit, not be as strong. But I always tell everybody with the smoker lines, even if you're not a smoker, the vertical lip lines or lipstick lines is a little nicer to call them that. Botox will make the muscle relax, but it doesn't actually get rid of all the lines that you see if you have them at rest. That's where we will use some lasers, or we'll use some dermal fillers to kind of actually fill in the depressions of where you have those little deeper lines.
And an extra large amount of a dose of prevention before they come.
Absolutely, just a little bit. And
they're hard to get rid of with everything, absolutely.
Yeah, and we don't use much Botox. And I guess we can talk about how many units we use. Amy, even if you want to run through that a little bit, after I get through all these, but the DAO, the depressor muscles in the side of the mouth, you can kind of pull your mouth down. This makes the marionettes look a little more prominent. The dimples of the chin, this is probably one of my favorite spots to treat. I love treating the chin. You get that little orange peel look, you get the little dimples in the chin. I've been treating, kind of sneaking that in on some of you guys who are my patients now, just because I can see it coming. You're starting to get the little dimples in the chin, and the Botox helps to kind of keep it smoothed out. And then we'll talk about the Nefertiti lift and the platysmal bands here in just a second. But do you want to kind of give a run through, Amy, about how many units you would need?
Yeah, that's, I think, everybody's question, how much is it going to be? Obviously with, like Jenny was saying, the programs that we have and the price points and stuff, are generally about the same, but, everybody wants to know price points of everything. But unit wise, we like to, some areas in the country, in different states, sometimes we'll go by different areas, say they might do the forehead, they might do the crow's feet, they might do the glabella, but they might lump those all into one. And not necessarily talk about, how many units you have. So don't be surprised if you go into different offices, but in our practice, we actually talk about every area has units. So in the forehead, I'll generally run between maybe 10 and 12 units. Obviously, we're going to touch up in 2 weeks if need be and go light, like Jenny said. Crow's feet, between the brows, that's going to, be between about 15 to 25 units. And I preferably, I don't really find a big side effect of using 10 units as a pretty good standard for crow's feet for most people. If they have that lower brow or a lot of activity there, I'll generally just put in 10 units. And I think that's the recommended dose there. And that's pretty much standard for me. And oftentimes you don't really need to touch up. A lot of times those, finer lines will come down through the cheek. We have to be careful about how, medial or towards the nose we go with that Botox. So, those are all things that congestion can occur if you add too much, but I always find that 10 units is a pretty standard dose for me and probably the rest of you guys, eh?
Yeah, anywhere. I mean, if I'm doing just a light kiss around the eyes, maybe 6 to 8 units of a light treatment, and then most people need anywhere from 10 to 12 units around the eyes. Now, this is again talking about Botox, Ziem, and Jeuveau. Dysport is about 2.5 to 3 times the amount, which is why people they sometimes will get into this little match about, well, over at this other place, I had Dysport and I only had 20 units and I had a complete block on my eye. 20 units of Botox, Jeuveau, Xeomin will definitely, do the trick. But when we're talking about Dysport, because of that smaller molecular size, we were talking about kind of how it shifts around, and it has to do with kilodaltons and all of these things and how it spreads. We're going to use 2.5 to 3 times the amount. So if we're talking about Dysport, we might use 50 to 60 units around the eye. But again, the pricing is a little bit different. So it really comes out to the same price at the end of the day, and you're checking out at the front, but it's just about how we dose it.
I always compare the Dysport and the Botox or the other neuromodulators to like Tylenol and Motrin. They're different dosages, but they have the same purpose, just kind of different mechanisms. But yeah, so that, a standard dose for I think most people is going to be between 35 and 50 units, depending on, sometimes your activity, your skin. I don't really go by age because I don't really care how old you are. I'm looking at your skin, I'm looking at your activity. That's basically, and what that would determine out to be is going to be dependent as far as the price points and any particular practice, as well as, the specials and different things that everybody's got. So, I would say between 35 and 50 units. And that would include between the brows, the forehead, the crow's feet. And then obviously as we dose into the lower face, that's just going to be,
lower face, we use less units because, we don't want you to not be able to smile. We don't want you to not be able to express, or your mouth. When we're treating the upper lip, it could be anywhere from, 2 or 3 units to maybe 6 to 8 units max, because if we put much more than that, sure, you don't have any fine lines, but you also can't move. So that would be a bad thing. The chin, I might put 6 or 8 units and that's it. Yeah.
That's that lip flip that everybody talks about that, we've been doing for years, but all of a sudden it's taken,
Right.
it's taken hold, and all of a sudden people are asking about the lip flip, but that Botox is what in the upper lip, that's what Jenny is referencing, is the 2 to 3 units. That's very tiny, that averts that lip just a small amount. If you get too much in there, which I've done it, I think most injectors have on certain patients. If I put in 6 units on somebody that just, including myself, has it takes effect very well for me. I can't say my B's and P's. It wears off in a couple weeks, but it drives me nuts. So
Yeah, I say this is not the time to have, try to be, drinking soup from a spoon the first couple of days.
Therapist, no Botox in the lip.
Do you want to show some pictures, Brooks? We'll get to the next one and just kind of start going through it.
Yeah, sure.
And if you guys have questions, please feel free to ask. So this is one of my patients, a male patient. The first picture is before and after at rest. You can see that in that top picture, he's got a little bit of that static line that we were talking about. He's not, super old, but he does have a line at rest. And then as you see in the second slide on the top, that's in animation when he's lifting his brows up. And then in the third picture, that's when he's furrowing. So those are all before pictures. And then on the bottom, of course, you can see his afters. His forehead, I placed 14 units of Botox across. And I think, yeah, he actually had Botox for his treatment. 14 units across. And then in his furrow, he had, I think, 24 units. He's very strong. He's male. He needs a little more units. And I think that his treatment came out pretty perfect for what he was wanting to see for his results. This was his first time treatment, and I was actually pretty happy with it because he's got a lot of muscle movement in that forehead. And I was just like, let's make sure he doesn't come back with like scary brows or, because it didn't want to over treat him. He'd never had it. He's a guy. He still wants some expression. And so he was pretty happy when he came back and couldn't believe how nice and smooth his forehead looked. The glabella, you can see, still has a little bit of a crinkle. Again, I wanted to maintain a little bit of that movement for him. Any more block, I think that it just would have looked, it would have been too much. He might have even started to feel heavy in the brows. So I did a good job with that one.
Sometimes we're our best complimenters. You got to be confident in this realm.
I know. But I really thought, and I told him, I said, when you come back, I'm going to have to put a few more units in your forehead. Your forehead is just, very expressive. And I really thought those above the lateral aspect, this area here coming up, I really thought he was going to still have some movement and some push out in that area. And luckily he didn't. And if he would have, it would have been fine, because again, we would rather not create, give you too much of a block and not like it, or have heaviness in your brows or heaviness, that make you feel heavy in the lid. That's worse. I can't make that go away necessarily. It has to wear off. So I'd rather have you come back and put a little more in if need be. And that's it on that one, Brooks. Very similar treatment for this patient. And she is very unique and interesting because she's got a lot of little lines all the way across. And so when we treat this type of forehead, some people have 1 or 2 lines across and that's it. And then other people like me and this patient, it's like stacked coins. I mean, or just folding laundry, they're just line. And that's from that frontalis muscle. You can see in her first picture, she has a little bit of those static lines, very young as well. So these lines start pretty early. It depends on how you express. I'm a brow raiser. So I had a lot of lines when I first started getting treated, and that's when I was 32. And this is me. I need you, Amy says. That's funny. Yes. So we treat that. You can see in her after picture of her forehead, she lifts up. You notice right above the brow and the lateral aspect, the very far side, she has that little crinkle. I call those commas. I have it too. I don't know if you guys can see it, but these little crinkles right here in the side, those, we talked about treating that if we get too low in that area, then what happens is the brow actually starts to depress. And so we have to pick our battles. I don't think that looks bad at all. She has a little bit of a line there. My preference is to not chase after those lines unless they're very distinctive, or if the commas are higher. If they're higher, they're fine. But when they kiss the brow like that, if we start chasing after those, we lose that brow lift ability, and we actually start to get some, dropping of the brow. She has a little bit, if you look in the very middle of her forehead at the top at her hairline, She's got a little bit of wrinkles left there when she lifts. I believe I treated her, I meant to look her up. I think I treated her with about 13, 14 units in her forehead. And so she still had a little bit of movement there. We decided, I think, to just let that go. It looks completely natural. It looks fine. But if she wanted to get a little more block up at the top, I maybe would have put 2 units. The thing with the frontalis is the little bit of the kind of anatomy science side of me coming out of me again, is when your frontalis muscle, it splits right here. It's called a bifurcation. So it splits right here in the center a little bit. And so when you lift your brow, it pushes up against this dead space. And so we can't always get that to suppress because there's no muscle there. And it's just where the muscle kind of goes up around it. So some people have a bifurcated frontalis that literally comes down in the center of their forehead. And so when they lift and we treat them with Botox, they'll always have a little bit of this U right here in the center. And it's very difficult to, get that to go away completely. And that's where that first time consultation comes in. I mean, it still looks fantastic. We still treat it, but it's that expectation is it may not be completely perfect because of the way your body is built. Everybody's muscles, everybody's a little bit different. So, and then her glabella, on the bottom where she's furrowing, she's got kind of that mean furrow. You notice that when she furrows, her brows pull down and it kind of closes the eyes a little bit. And then, so that's one of the things we want to try to treat to get the brows to kind of even out a little bit. This was her first time treatment. So when she came back and you see the glabella, there's still a little bit of push there. She decided not to treat it. I agreed with her. I'm in the school of thought that I like a little bit of motion. I like a little bit of movement, but some people wouldn't like that, and that's fine too. We could just put a couple more units in there and maybe give her a little stronger block. But I think for a first time treatment, like I said, she really liked her first time treatment. The second treatment, she's going to love because the muscle is going to be even more. I mean, she loved it anyway, honestly, but the muscle, that glabella muscle, each time that we treat it, if you treat and retreat in 3 months, we're training, again, we're telling that muscle, don't move, don't move, don't move. And we're breaking those bad habits that we all have, furrowing and pulling those muscles together. Any questions on that picture? Let me see, that you can lift the brow with neurotoxin. Not many places know how to do this. Yeah, so we can lift the brow. Not everybody will lift, and that's it, Amy, you agree. Like some patients, and that's part of your consultation is that some people are just, their muscles, they've suppressed, they've lost the elasticity, the skin is loose, and we can't get them. I mean, they won't lift much. The goal is obviously never to have them drop. And we don't want to lift everyone, especially with men. We don't want to feminize them, but because they tend to be flatter anyway. But we treat the glabella to get the medial aspect of the brow to lift here, and then we treat the lateral aspect of the brow to lift here. And it only takes a couple units in the lateral brow. There's a ridge that we look for, the frontal temporal ridge, and anyway, but and to try to get you to lift.
There's that science girl again. I think really important just to add into that too, Jenny, is that you can tell that she's super slight all the way down. That thin skin is going to matter on that neuromodulator of who I'm going to use. You can tell that she's thin skin. She's probably a thin frame. She's got thin hair. She's got thin veins. She's just thin all the way down. And she's almost automatically a Botox thought for me. I don't know what you used on her, but she's a Botox girl. That frontalis is so busy that I can't believe that you ended up getting as nice result on that first treatment. It's pretty impressive. Yeah. Because that forehead muscle goes all the way across, and to not make her heavy in her slightness of her skin and such is really hard to not, get her to be, too drawn down or caveman-like, and it really still has a nice lift. So yeah. Great.
And a lot of times with these first time treatments, that lateral aspect of the frontalis, that outside area is where we need to touch up, because all of us injectors, we don't want to get too far out there and then you get heavy. That's miserable. That's worse. I'd rather you come back with a beautiful smooth center and and I need to do little tweaks on the side, because that's better than the opposite. So
I think that's just why we have to make sure, and in your injector, whether you have us or somebody else, you always want to be in activity and in what we call repose. And that's just a still picture of what you look like, and making sure that, your activity looks as good as it does when it's still.
You want to go to the next one, Brooks? So Amy, this was one of my patients too. What do you think?
Mm-hmm. That is on the opposite end of that girl previously. It's crazy. What thick skin. Holy cow, that thick vascular skin that's oily, that is, you know, just as hard as the other girl was. Now he's an automatic disc port for me because of that thicker, oily skin. Yay!
That's what I used.
I would like to play games. We got to make sure that we're on the same page here.
Yeah.
It's amazing.
Yep, and so static lines at rest in the forehead, and very kind of thick, stronger male muscles in the forehead. I did use Dysport on this patient, and you can see in the center picture before and after when he's raising his brows, you can see those lines I was talking about, the lateral aspect, where you can still see some of that motion when he lifts up. And again, first time treatments, we don't necessarily want to overdo it. Don't want that area to get heavy. So I did go back in and make some adjustments on that. And then the furrow still has some furrow, significantly better, super happy. And I can say that this client has been with me for a few years now, and just keeps getting better and better and better and better, and not needing treatments as often. And the skin is just remarkable now. And I could show you forehead now to this, 3.5 years ago. You wouldn't even know it's the same person. It's pretty awesome.
Yeah, it's amazing. I'm just going to stop real quick for a question. I have a patient on here that said, do you prefer Botox of the newer neurotoxins? Do others last longer than the Botox? And for me, I have to be honest, I do have a preference for Botox and Dysport. Jenny might disagree or have I need to chime in on that. But for me, I have a preference only for Botox and Dysport, and not because the other two don't have a really solid standing. It's the education in time that sometimes gets me in a tricky position. So if you are super unfamiliar with a Jeuveau or Xeomin, Botox and Dysport is kind of going to be my go-to only because of the branding. It's kind of what people already know. And that doesn't mean that we won't sit and chat about it. This is why Jenny and I are doing this particular conference, because I think it's important that we get that education out there first. So those other two names also stand as strong with Dysport and Botox. It's just a preference for me that I generally, because Botox and Dysport have been around longer, but the other two have a super strong standing with patients.
Yeah, and Jeuveau has an FDA approval for glabella lines only, which is the furrow, not for the forehead and not for the crow's feet. Does that mean that I don't use it there? Of course I use it there, but it's just they're not going to go after those indications because it's another FDA approval and it takes time and money, and it's a newer product. So they just haven't done those studies yet. And they may do the studies on those areas just to get the approvals, but it's kind of like, why? They don't necessarily have to, in my opinion. But it does give that, Botox and, does have the FDA approval because they have done the studies and they have been around for a long time, and it's been kind of the tried and true. And so it does have the most research behind it, backing. So it's, they do have other approvals that other neurotoxins don't have. But again, does that mean that you can't use them in those areas? No, you absolutely can. It's just they don't have those FDA approvals, and that's just because they're not going to go after it. It's too expensive, or they just haven't been on the market long enough to, get the approvals yet. So, but they still work.
And we're going to use it off-label.
Use it all over the place.
Good questions, though. Good questions.
And the next picture, Brooks.
All right, so this is my patient who obviously has a lot of activity, and her personality looks just like her face. She's busy, animated, and always like that. The Botox has definitely tempered her, and I think as she's gotten that consistently, it's almost like her, I haven't subdued her, but she certainly isn't as body animated, even with the muscles in the face having been a little more subdued. But she has a lot of asymmetry. You can see that she pulls up a lot on her right side of the brow. And that is, so I want to touch base and just real quick. I don't know if I can probably point this out as well. I'm going to try to explain it, but I like the actual brow to be, well, in general, cosmetically, you're supposed to have a 1 inch from the medial brow, the inner brow, and it's hard for me to get off the science and anatomy speak sometimes. So from the inner side of your eye to the arch should be 1 inch, and then should be about another inch from the arch to the lateral tail or the outer tail of your brow. So it's really an artistic injection that we want to make sure that that arch of that brow comes at the lateral side of your iris, the color of your eye. So I had to be super careful and make sure that she didn't get too heavy. Sometimes I see patients that they come way too far out laterally or to the sides, and your arch is beyond, you know, your wider show of your eye. So it's super important for Jennie and I to make sure that kind of feminine appearance, especially for her, actually has aesthetic appeal, to make sure that the arch is in place, not just to get rid of the wrinkles. So she got a great result, and she was a Botox patient, and she comes in every 3 months for me.
And I just want to compliment you that her right brow is so strong. What we were talking about earlier, like really assessing the patient, is you don't inject the right side the same way you did the left. You know, I mean, it's not like she's super asymmetric. She's beautiful, but she's got some asymmetry. And then when you treated her brows are her right brow is ever so slightly off from the left brow, but it's significantly better, and that's what we're trying to go for. Symmetry and balance is always the answer. You could have treated her left and her right the same way, but her right would have still been up higher than the left and been completely asymmetric still, and so it just absolutely looks gorgeous. She looks great.
Yeah. Thank you. Yeah, she's a great result, and that's what we hope for all patients to have, is in even the roundness of the arch. I want to give a little more peak, not such a round kind of baby face angle. I'm, you know, and myself, and I know Jennie is too, all about the angle of the face, and really truly the brows, as well as other areas in your face, is about an angle, and we have to make sure it blends with your face and really your personality.
Mm-hmm.
Sounds weird, but you have to come in and let us talk to you about that, because it really is a weird psychological thing behind it, that we connect those products to you.
Did you treat her bunnies as well?
I did. I was going to point that out. Yep, sure did.
It's so funny that, because, you know, as injectors, we see things immediately, and so like, you did treat them, right? Because they look fantastic. But this is an example of, you know, when she furrows, she scrunches her nose. And so you've got to treat that. If Amy would have treated her glabella and didn't treat her bunnies, then it would have looked silly. She would have had all that motion in her nose and nothing that, you know, up between the brows. So
yeah,
kudos to you. Good job. Great job.
Thanks, girl.
Mm-hmm. So this is one of my patients. We did just crow's feet, just really soft and subtle. I think I used some Botox on this patient, and she doesn't have significantly deep lines. She just got lots of little tiny lines when she smiles. And so even though she's kind of looking down on the first one and kind of straight in the second, you can still see that dynamic movement there. She used, I think we did about 8 units on each eye, so about 16 units total. So just really pretty, kind of softened in, came into that right to the corner of the eye here, kind of came down, put a little bit in this area to keep her from bunching up in this corner. And that worked very lovely for her. So
she got a little brow lift too there, Jay.
Mm-hmm. Yeah, injected her a little bit high in the brow to get a little bit of a brow lift. So yeah, she's kind of like a slam dunk type patient. You know, she doesn't have a lot of lines at rest. She's very pretty. Her skin is good integrity. There's not a lot of laxity. I could put a little bit or a lot in there and she's going to get a beautiful result. So those are kind of they're like, yay.
Yeah, that's beautiful. Her skin looks amazing. It's funny how the skin just improves. It's not just the wrinkles reduction, it's the skin that improves as well.
Mm-hmm. Yep. Okay. Who dat?
One and only.
That's Brooks, the one controlling the pictures. Amy, do you want to talk about this one?
Yeah, so, you know, again, that nice crow's feet, just tiny start of that, you know, from the crease out, is Brooks was starting with that, and just, you can tell that it's just softened that smile. And Brooks is more of that preventative. It bothered her, so Jennie injected her with that Botox, and it really just is going to keep her skin from having what I call scar-like wrinkles. You know, that dynamic activity with that skin constantly, you know, contracting and releasing will cause scar-like wrinkles. So she got a great result there, and I'm sure Brooks can tell you that she's really happy about that.
And then the other area, if you look under the eye, that jelly roll that we talked about, this is a good example of just sneaking a little tiny bit in there to really kind of help keeping this area a little smoother as well. So just kind of snuck in a little unit on each side to kind of help her smooth that out a little bit. It makes a nice difference.
That's her best compliment right there. I mean, that's what the compliment probably that Brooks got. We're not, people come in and say, I don't want to look different. I don't want anybody to know. No one will know. You'll know. If you're looking to come in for somebody else to know, you're probably not a good candidate to get these injections, and you may want to think about something else. But for this, you know, the injections are about small differences that make you look like your hair looks different and better, or you've got great makeup on. Nobody can quite put their finger on, and that's the result that we're looking for.
Yep. So Brooks is not super strong. She doesn't have super deep lines, real natural look, but she's just kind of showing you in animation, you know, her kind of results, the difference of her before and after. So.
Mm-hmm. Yeah, looks great.
So this one, you know, we had a question earlier about the difference with Botox and Dysport and Jeuveau. And so we had a little bit of fun at Azura back in January, and we had our patients email us if they would like a free treatment. So who wouldn't want a free crow's feet treatment, right? So it didn't matter if you'd had it done before, if it was a first time treatment or you'd had it done for years, you just could not have had a treatment within 3 months with any kind of neurotoxins. And so what we did is on one side, we injected Botox, and on the other side, we injected Jeuveau, because we wanted a really good understanding of, you know, what's going to last longer, which is going to kick in first. Do we see that much of a difference? And so really it's, you know, oh, and the other thing is that it didn't matter if the patient needed only 6 or 8 units on each eye or really needed 12 to 14 units on each side. It didn't matter. We gave everybody 10 units of Botox and 10 units of Jeuveau. And it was really hard as an injector because there were some patients I was like, this would be a little better if I used 12 or 13, or, you know, she only really needs 8. But for our like little in-house study that we did, we wanted to make it completely controlled in the fact that we did the same thing on every patient every time. We selected 10 people, and this is just one of them. And basically, you know, from people emailing us in that they wanted to participate in this. And so the right eye is Botox. The left eye is Jeuveau. So you can see actually she's pretty symmetric. She pulls in a little differently. This is another good example of asymmetry. She has very similar lines. She has similar pull. On the right side, she pulls in maybe just a little bit more on the under aspect of her eye, maybe pulls down a little bit more on her brow on the right. Her lines are pretty symmetric and pretty similar in depth. So sometimes people are really deep on one side and not as deep on the other. And then so one eye responds better, but she was pretty symmetric. So she was a good candidate for us. And then you can see on the right side with the Botox, her after pictures at 2 weeks. And then the third picture, the pictures down on the bottom, right and left, are at 3 months. So I'm pretty much looking at this going, it's about the same. We had some people say they felt that the Botox kicked in first. We had some people, probably about say they felt that the Jeuveau kicked in first. So
yeah,
it didn't really give us it really didn't give us a conclusive, you know, and again, it was just 10 people. We did it in the office, you know, but it was kind of fun for us to do it because we can read the studies from the companies all we want, and go by those, and they're very well controlled. I mean, they're way more controlled than what we would do at Azura. Like I said, you know, just only having 10 people. I mean, you need a higher population to really get a good study, but in different injectors. But I was the only injector, did all of them so that we could see the difference, because everybody injects a little differently. And I think that the results go to show, and somebody just said for me, the Botox for sure kicked in first. Yeah, we had a lot of people, you know, we had some people say, yep, the Botox kicked in first, and other people say the Jeuveau kicked in first. So, but I think if you look at the 3 months, so we started this in January, and then at 3 months, we wanted to have everybody come back for pictures and then insert COVID, right? So we're at that point where we're getting our 3-month pictures, and we're like, oh, well, we can't bring you in to do it. So this patient was kind enough to send us her pictures. She took it home, her little selfie pictures. So, but still looking pretty good at 3 months. So, and I can't remember if this patient,
Isn't that what Jeuveau kind of touts as well, that they actually have found that it kicks in sooner?
I think
And
so,
studies?
yeah.
I don't know if that's legit. I'm gonna have to go back and look at that, but I feel like that's one of the things that they actually could advertise.
Yeah.
I'll have to double check, which metabolically everybody's different. I can't
Yeah.
say that, you know.
Yeah.
That's not
But
easy.
she, you know, she was pretty happy, and I mean, still looks pretty good. So can we say one side worked better than the other?
Exactly.
I mean, they look pretty similar. And for most of them, of the patients that we saw everybody back at 2 weeks, because that was part of the deal. If we're giving you a free treatment, you have to commit to coming back. So everybody looked pretty good. I think this was that another one from the study that we did. Yeah. So that was your baselines. And this was another one. Again, we injected, again, everybody got the same amount, no matter how much we felt they needed. She still had a little bit of push on both sides, but again, Botox to Jeuveau, pretty similar, you know, and that's at the 2 week mark. We haven't been able to get a 3-month update on this picture, but pretty similar, you know, right to left.
And that eye aperture is more open. I mean, on both sides. So you can appreciate, even if it's the wrinkles are softer, but the eye opening is what everybody likes too.
And if we weren't, you know, doing this in-house controlled kind of thing, I probably would have done a little bit more to give her a little more brow lift. Potentially, I might have kind of snuck under a little bit to get some more lines underneath. But again, we were doing the same exact amount on everybody and doing the same injection points on everyone. So, but I think that's pretty good. It looks pretty similar.
Yeah, looks great. So this is my patient. She's a little more subtle, but this is also only after her first treatment. And we did Botox in her masseter muscles with that. And she happens to be Asian. So that Asian population likes that slimmer jawline. She was the right candidate for this particular procedure. So we added about 25 units of Botox to either side. Some people also get this when they have that TMJ. We don't necessarily treat TMJ. We will inject the masseter muscles to slim the jawline, but TMJ is a whole other issue of sorts. But she did come in particularly for a cosmetic revision of that. And actually, I wish I had the third picture, because this is at 6 months, because we have to get some time under our belt to have that reduction of that muscle. Because like with anything else, the contraction and the hypertrophy or that buildup of muscle happens. And so we ended up getting a nice slim jawline, and hopefully I can share that with Brooke so she can share with you all that I do have a 18-month timeline now, and she's got a great shape. So, and it lasts a long time.
You look great.
Love that.
She was super happy.
But she definitely saw a huge difference, and her whole face just is more balanced.
Yeah, she looks great. Good job. And a lot of times people will come in and they'll, you know, be grinders, and they have the masseter just sticks out, and it makes them look boxy. And like Amy was saying, like you want that more feminine kind of cut in. And so we can help to get those masseters not be so, it's called hypertrophy, or, you know, where it's larger, get the muscles to kind of shrink down. And it's super interesting because, you know, in some areas, the Botox tends to, you know, or any of the toxins, I say just that, but any of the toxins, will last, you know, only so long in certain areas, but in the masseters, it does seem to kind of, you know, last a little longer. Same thing with like when we're treating off-label, or not off-label, but non-cosmetic, I guess I should say, like hyperhidrosis, it lasts longer, you know, when we treat patients like that. And that's a whole sciencey autonomic neuron versus, but motor neurons. But anyway, you know, certain areas it'll last longer. But I got a question here. I think, is that our last picture, Brooks?
No, one more, chin.
Oh yeah, this is a good one.
Okay. Yeah. So this patient just had that dimpling in the chin and very strong depressor muscles in the corner of the mouth, kind of just pulling her down. And I have this pretty bad too, so I like to keep my DAOs treated. But you know, putting a little bit of Botox in the lower face can make a huge difference. I'm really, you know, very surprised that I used, Amy, if you believe it, I used 6 units of Botox in the chin, and I used 3 units on each side of the DAOs. and sexy gal, Jesse's.
Oh, total. That's
So
bananas.
12
Yeah.
units total in this lower face, and made a remarkable difference for this patient. And I mean, I just think I'm pretty proud of that one too.
Those
So
downturned corners of the mouth, and she has that natural muscle anatomy that wants to turn down anyway. So that it's not only just for correction, but it's for prevention for her as she ages. I mean, it's just outstanding. And I know patients, or other people that are on now who may not have that anatomy, but it's just crazy what a difference that tiny bit of Botox made.
And she's young enough that she doesn't really have those deep marionette lines in the corner of the mouth too much, a little bit of that downward turn, but not much. But this is, again, an example of that prevention. If somebody is constantly pulling like that, just with expressions, and I do it all the time, which is why I'm like, oh, can you believe? And I do that. I just make that. That's one of my faces that I make. I just do. And so I have to train myself. I do it. And then so I put it in here because I don't want to see those deeper marionette lines. You'll still get them in time because you have volume loss, and that's a fat thing. That's a different talk for filler discussion. We can do it another time. But if you're not always kind of pulling against that area, that's really going to kind of help, prevent somewhat of seeing that sooner sooner than we want. So,
yeah. Sexy skull, Jessie. Absolutely.
I think, is that the last picture, Brooks, or is there another one?
No, that's it.
Please do a filler tutorial. We'll get there too, Wendy. Thank you for that.
I'm gonna stop sharing it.
Yeah, I did get another question about platysmal bands. So platysmal bands is another area that we treat for the neck. So I haven't treated mine in a while. I think last time Jessie may have treated them the time before. I think Amy might have treated them. But these muscles here, you can see when I do this, these muscles, I mean, Amy, you just want to shoot these from across the computer.
I can't even take it. It drives me bananas.
Drives you crazy. So these muscles here, over time, they kind of pull out and they can cause some laxity. And so you can kind of see when I turn, oh gosh. Somebody asked earlier, do you guys treat yourself? I usually don't treat myself. I make other people inject me because the only thing I'll treat is maybe my upper forehead. And other than that, I'm not good injecting myself. A lot of people do, but I don't. So I have Jessie and Amanda and Amy do it for me because there's so many people around. Why would I inject myself? But now somebody asked, are we treating ourselves while we're stuck at home? And I'm like, not yet, but it's getting close. So thanks for that question. But we also treat these platysmal bands. And that just kind of helps to kind of pull in the neck. And that's part of what's called the Nefertiti neck lift as well. So there's something called Nefertiti neck lift where we treat the platysmal bands so that we can't, have the muscles not pulling out so much. And then we also treat the chin and the DAO muscles here in the corner for the depressor muscles. And sometimes we also treat the masseters as part of that too, if someone needs it. So it's a combination of those things. Each band typically can take anywhere from 6 to 20 units of Botox. So it just depends. We don't want to overdo that area. And sometimes I'll actually come down kind of the cleavage lines here. I don't know if you do this at all, Amy, but I'll sprinkle a couple little units across the chest here, and that helps to kind of smooth the chest out a little bit. We also treat that with, lasers. And sometimes if there is a deep little line, I'll smooth it out with some Xeomin or Botox or Jeuveau or whatever. And then I'll go in with a little filler as well. But
sometimes I'll reconstitute my Botox or Xeomin or Jeuveau, whatever, with a little more saline so it doesn't seep too deep into the muscle and it stays in the skin to reduce some pores. It's not a long-term effect, but it certainly is that wow effect that's going to give you that wedding weekend ready skin. Say you do it on a Monday, by Saturday your skin is really nice and tight and firm, and it'll last a couple weeks. It's a very small dose, so I will do that to reduce the pores. Obviously want you to do other things, but I do like that treatment.
There's little micro treatments for rosacea and all kinds of things.
Yeah.
Toxins are great.
I know they are. It's crazy how much you can do, and hopefully we answer the majority of your questions. We know that obviously filler is always a want to go ahead and do with the toxins. I think they just get so confused, and I wish we could put them together without making them, just layered on layered of confusion. But it's easier to just go with one so you can see. And that's how we treat you as patients too, is that we layer. I like to have patients come in and get their Botox, and then I like to have you come back and maybe consider getting a filler or obviously lasers or whatever it is, because I want you to appreciate the treatment that you're getting from me. it doesn't mean that I can't do Botox or filler at the same time. It's just a matter of, I want you to know that you can put your trust in us, see your differences of your treatments with one thing at a time. And then as we establish a better relationship, then we can start to blend all those things together. But I think for, a lot of you don't know me, a lot of you know Jenny and Jesse, but I do think that, if you came to know me, that, I'm going to want you to establish just with one product at a time.
Mm-hmm. Sure. We just got a question from Patty. She said, can we get on a wait list for when you open, or are you doing any in-home treatments? Patty, if I could, I would, girl, but
we are worried about
absolutely. You can send an email to hello@azuraskin.com, or you can go onto our website and request a appointment. I believe Lisa actually she works with our marketing and she's a patient. But I think Lisa, it's down at the bottom. Like right now we might have the request an appointment down towards the bottom because the virtual consults are up on the top. Yeah, so I think it's when you scroll down, but you can request an appointment on our website. Supposedly we're allowed to be open on May 1st as of right now. We're closed until April 30th, open May 1st. I don't know that that's going to happen. You guys are watching the news just like I am. So, but we do have some patients on for early May. But what we have been doing, Tiffany has been going in the office a couple times a day and working on phone calls and emails, and we're scheduling from May 15th out. Hopefully that will be open and kind of getting closer to back to normal. I think that probably when we go back to work, it's going to be staggered appointments type of thing to keep you safe. And we might not have every employee back the first week or two, just kind of trying to stagger and making sure that we're keeping social distancing and doing what's right for us and for you guys. So, but as soon as I'm allowed to open those doors and put a needle back in my hand, I absolutely will. But yes, please email us and we'll get you on the list. And make sure that you guys have, if you joined in a little later, make sure you send your email to Brooks, who's on here. You can send it privately to her because we're going to put a $25 credit on your account. So for saying thank you for joining us on our webinar today. So any other questions for us? Lisa said that it's under the Get in Touch section of our menu at azuraskin.com /contact, and then request an appointment. So you can do it that way. It's kind of buried a little bit since we're operating a little differently these days. So
kind of like getting your payment from the government, except easier.
So, all right, ladies and gentlemen, if you don't have any other questions, we've been talking a little over an hour now. So Botox is so easy to talk about. I mean, I could talk for hours and hours and hours and hours and hours. And I know a lot of people can probably listen for hours and hours because it is so interesting and it's super fun. So, but if you have any other questions that we didn't get to, feel free to email us at hello@azuraskin.com or send us a message on social media, and we'll try to get back to you as soon as possible to answer any questions that you might have.
Love to see you guys follow it up too with all your filler questions prior to, so everybody can address when that does come to be, that we can do this again, and that whether Jesse or Amanda and Jenny, but that all those filler questions can kind of come into play and email Brooks or Tiffany, either one.
Yeah, we have 4 neurotoxins that we have to choose from. Then when we get into fillers, we have a lot to choose
from. What is there, 100 in the world that are to choose from, and thank God we only have 4
brands, right? So
thank God, right?
Oh, you mean neurotoxins? Yeah,
neurotoxins, right? Yeah, fillers. I don't even know how many there are. Multitudes, but either way, no. Yeah. So thanks so much. I appreciate you, Jenny, Brooks, Tiffany, as well as all our clients, and we hope you're all well. And it was really good to re-engage with you all.
Yeah, thank you. It's really kind of about me and Amy. We just needed to talk to some people for a while.
Give me a soul here. Yeah.
It feels good. So thank you. Yeah.
Appreciate you all.
All right, guys, have a great rest of your day, and we will see you soon.
Bye.